This is the topic about renal dialysis. Definition: the process of removing excess water, solids, and toxins from the blood in people whose kidney can no longer perform this function properly. This is referred as renal replacement therapy. The first successful dialysis was performed in 1943. Dr. William Culp is considered the father of dialysis. He constructed the first dialyzer. It follows the process of diffusion from solid removal and osmosis and ultrafiltration to normalize body water. Purpose of Purpose of dialysis. Dialysis is required when end-stage kidney failure is developed. EGFR test help us to find out the condition of our kidney. It is usually done when the patient is at high risk of developing kidney disease. When EGFR is 15 to 29, there is severe loss of kidney function, and less than 15 means kidney failure. Most common factors for renal disease are given below. These are like glomerulonephritis, diabetes, overweight, high blood pressure, medications like NSAID and this aminoglycoside, ADC. Types of dialysis. Hemodialysis. There is a arteriovenous graft, arteriovenous fistula. Next one is peritoneal dialysis. Hemodialysis. It is a process to remove waste and extra chemical fluids from blood using an artificial kidney, that is hemodialyzer, outside the body. It is done by making excess into the blood vessels. It is done by minor surgery in arms or legs, a fistula, an excess made by joining an artery and vein in the arms, and a graft, an excess made by using a piece of soft tube to join artery and vein in the arms. When a patient's vessels are not suitable for fistula, graft is done. Grafts are usually placed in forearms, upper arms, or lower upper thigh. Dialyzer. The dialyzer has two parts, one for blood and one for washing fluid, called dialyzer. A thin membrane separates these two parts. It consists of filtering fibers which removes excess fluid and waste product. Blood cells, proteins, and other important constituents remains in the blood as they are too big to pass through the membrane. Small waste products such as urea, creatinine, potassium, and extra fluid pass through the membrane and are washed away. Composition of dialysate: sodium, potassium, chlorine, HCO3, acetate, calcium, magnesium, and glucose. These are the normal value, it should be maintained. Process of dialysis. Procedure is started by creating graft or fistula in forearms or thighs of the patient. Then two needles are inserted into the graft or fistula, allowing a circuit to be set up with a dialyzer. Then the blood passes into the dialyzer, which consists of filtering fibers that removes waste product and excess fluid from the blood. Dialysis acts as absorbing solution for undesirable substances in the blood. Then purified blood returns to the body through exit site. During the process, arterial pressure, dialyzer inflow pressure, and venous pressure is monitored. This is the figure. Peritoneal dialysis. In this dialysis, membrane lining in abdomen, that is peritoneum, is used as filter rather than a machine. Like kidney, peritoneum contains thousands of tiny blood vessels, making it useful filtering device. Uh, Fluid is pumped in peritoneal cavity through a catheter as blood passes through the blood vessels. Lining of peritoneal cavity, waste product and excess fluid are drawn out and into the dialysis fluid. The peritoneal cavity can be hold more than 3 liters, but in clinical practice only 1.5 to 2.5 liter fluid are used. This fluid this used fluid is drained into a bag a few hours later and replaced with fresh fluid. Peritoneal dialysis. Types of peritoneal dialysis. It is of CAPD, which is called as continuous ambulatory peritoneal dialysis. It happens throughout the bodies while the patient goes out his her daily life. It does not need a machine. He just need is gravity to fill the empty stomach. Between 1.5 to 2.5 liter of fluid is run each time for 4 times a day. APD, automated peritoneal dialysis. In this process, dialyzed solution is changed by a machine at a night while the patient is sleeping. The machine exchanges 8 to 12 liters over 8 to 10 hours. Hemodialysis complications, that is hypotension, muscle cramps, clot formation, septicemia, disequilibrium syndrome. In peritoneal dialysis, exit site infection, peritonitis, abdominal pain, hernia, lower back pain, protein loss, atelectasis.